Now the axes and the planes for both the superior and inferior shear are both the same as it was for flexion extension. So it'll be two transverse or horizontal axes, one for the sphenoid, one for the occiput, and they're going to move in a sagittal plane. So now we're going to talk about a superior shear. What would cause a superior shear? So some kind of force, trauma, fall that is inferior to the jaw coming up towards the body of the sphenoid. Could be an uppercut, a boxer, fighter, bar fight, any of those kind of things. There's a force coming up through the jaw towards the body of the sphenoid, displacing the sphenoid and moving it superiorly. Remember, we name everything after the basisphenoid. So now the basisphenoid is superior to the occiput. All right, now what's going to happen is we always name it again after what the basisphenoid does. So during flexion, a superior shear of the basisphenoid is going to move superiorly around a transverse axis. Again, it's in the sagittal plane, just like flexion and extension. Okay, now the occiput is going to move inferiorly. Okay, all right, again around a transverse axis in a sagittal plane during flexion. So that's what a superior shear is going to look like during flexion. Then extension, they sort of approximate again. Okay, all right, and then during flexion, the basisphenoid moves superiorly, the occiput moves inferiorly. So in a superior shear, as you can see, the basisphenoid is going to rotate during flexion, right? Basisphenoid is going to move superiorly. As you can clearly see, that's a clockwise movement. And the occiput is going to move inferiorly. Occiput moves inferiorly. As you can clearly see, that is also a clockwise movement. So in a superior shear, both the sphenoid and occiput move in a sagittal plane around two transverse axes, and their rotation is both clockwise, so they're moving in the same direction. And a superior shear pattern is pathologic. And what's going to happen with the superior shear, so this uppercut is going to cause the sphenoid to be displaced superiorly. Okay? All right? So this is normal. Uppercut occurs, boom, it's displaced superiorly. Now, remember, we always name it for the basisphenoid. And so the basisphenoid is superior, it's also going to move superior. So, superior shear, superior shear, superior shear, superior shear. How that's going to feel in your fingers, and look, during a superior shear, do you see how those greater wings are moving inferiorly? Okay, see how they're moving inferiorly? So during a superior shear, what's going to happen is you're going to feel your index fingers both moving inferiorly. Superior shear, superior shear, superior shear, superior shear.